And I'm going to tell posterity that this is the Board of Health meeting of March 4th, 2026, and we are all here. Myself, Catherine Hilton, Wim Levine, Garrett Simonson, Noreen Pease, Arlene Reed, and as our guest and future board member, Claire Pless. Hi, you guys. Everybody good?
Very good. Thanks.
Excellent. There isn't really much of anything on the agenda. Let's vote for the minutes. I can't even remember when we had a meeting last.
I'll move to approve.
Second?
Okay. All in favor? Arlene?
Yes.
Who's next? Garrett?
Yes.
Noreen?
Yes.
Wim?
Yes.
Cat, yes. Okay, so whatever those were, they are good. As I was about to say, we didn't really need much of a meeting tonight, but I wanted to try to get us back on our regular schedule and just have a check-in because we haven't been meeting as often as we are supposed to be. So I wonder if anybody has anything to report.
I read that article you sent, Arlene.
Oh, yeah.
That was
Now I've forgotten what article I sent.
it's become a NIMBY issue about
Oh, yes. Right. Got it.
Right.
Yeah.
Right. I don't know if you guys know about this. Maybe I've sent it to you or not, but apparently they're bringing in a sort of unified permitting process for various solar things. And it's a single permit that all the town boards that are implicated have to sign off on. And I guess such a permit has to be created. So and that has to happen sometime during this year. I'm not sure exactly when, possibly July 1st. So I don't know if we're going to need to get back to our battery storage regulation before that or not. I'll try to find out more about that. I personally have not done anything about the battery storage regulation for many weeks. I've been really swamped with other things, but this was probably a good time to get back to it.
is that unitary approval? Does that apply to individual homeowners, like with an array on their roof?
I don't know. I don't think that was the point of it, but
It's for these
I
big
don't know.
projects.
That's what I think. There's something from Michael DiChiara that I'll send around to everybody, so maybe you can get a better sense of it. But my guess is it's for the big projects.
Yeah. And the state already regulates the maximum that a residential can do. So I don't remember what the total. I think we're at the maximum with our solar.
And that's measured in kilowatt hours.
I think so. Yeah.
Okay. Yeah. In any case, we don't have to regulate that kind of stuff. There's plenty of regulations for that without us. Noreen, we were talking a while back about my working more closely with the collaborative. And although I have dealings with them all the time, I'm always asking them to do things for us. I haven't gone to any meetings or anything like that. Are those meetings that are on a regular basis, or are they announced? Have I missed some, or?
You are now on the list, Kat. You should be getting the memos along with everybody else. And as I recall, I recommended it to you because you would meet. It didn't sound like you knew all of your counterparts in the other towns, and I thought it might be useful, at least for you, between now and the time perhaps that I leave to get acquainted with some of those people, because there's common problem solving that can come out of these particular units. And to let Claire know, the Valley Health Collaborative started, I don't know, help me, Garrett, 3 years ago now, perhaps?
That
Yeah, I
long
think
ago?
it's three or four.
3 or 4 years
Yeah.
ago.
Oh my God.
And for the first time, really, in the history of Massachusetts, there is a fair amount of money, or some money, let's say, put into public health programs in towns throughout the state. And we applied along with Greenfield, Montague, Leverett, Shutesbury, Sunderland, and Deerfield to be part of it's the Eastern, we don't call it that, but it's really the Eastern Franklin County Health Collaborative. And we've received funding for the last 3 years for this. And members of boards of health meet once a month to discuss what's going on. And for example, the reason we have public health nurses in all of the towns right now is because we've had this money available. So we worked on some really, I think, helpful collaborative kinds of projects, and it's a good opportunity to get to know our neighbors and what issues they're dealing with, and perhaps they've just updated their regulations on something, and they can help us, we can help them. So that's a little bit of background, and I'll report now on what came out of the last meeting. And I don't know if you remember Athena Bradley, but she used to be the grants writer for the collaborative, and now she's the grants writer for Greenfield. And one of the questions last time I reported on the collaborative was, how are we going to sustain ourselves into the future? So I have two semi-answers to that question now. One is Athena and folks in Greenfield are applying for a grant. It's a Health and Aging Funds grant to be coordinated with Village Neighbors in our 6 towns. And it would be a 3 to 5 year grant. And it's Athena, who's an excellent grant writer, was very optimistic that there was a good chance that we would get funding. And she has written all of the public health nurses into that particular grant. And the money would go to locals for training, for promotional information, for monitoring, again, the public health nurses. It's been a month since this meeting, so forgive me if I don't remember everything. And some of the programs would be working through senior centers and the libraries. And this grant would start as soon as July 1st. So everybody there was pretty enthusiastic about it and pretty optimistic that would be something that would come through and might even, in fact, supplement some of the funds that we have through the collaborative. And the second piece of news was that Mara Healy has placed in her budget a request for $15 million for the continuation of the program. Now, of course, just because it's in her budget doesn't mean that it's going to happen, but that would continue the funding, from the state for the program, which doesn't end until June of 27. So anyway, we look at it, we have at least another whole year and 4 months of funding as we are now. I think that's all I have to report. We didn't decide on it. Wait a minute. Do we have an upcoming? No, we don't have an upcoming meeting date. But help me. We meet the second Thursday.
Yeah, I think it's the second Thursday.
Second Thursday of every month, Kat. As I
Okay.
said, you are now on the list, so you'll be getting that notice.
So that should be next week.
Yeah. Okay. Thank you. I don't know who I am, where I am, or what I am, but thank you.
And it's typically at 8:30 in the morning.
I do know I'll be another year older next next week, and that might make things worse or better. I have
Maybe,
no
maybe
prediction.
better.
I have no prediction on that count.
All right. There's something that I'm a little bit confused about, and that's this whole business of supplementing the grant. Now, it was explained to me that we can get health agent services from the collaborative, partly because we are members of it, and any share of money that came to our town went to the collaborative. I assume that that's how that works, but that basically we can only get supplemental services from them, and so we have to have something on our budget that shows we're spending money on public health ourselves.
Yes, basically, another way to put it is we cannot supplant any money that we are already spending for public health by using collaborative funds. So that if we already have money we're paying for public health services, which we do, then those have to continue to be spent on public health services on behalf of Shutesbury, which is why they want to set up an account separate from those funds that come in to fund the collaborative, Cat. And let's say Deerfield, for example, also has money that it spends on public health. So does Leverett. So I think what we're envisioning is down the road, we would pool those monies in a separate account, and those monies would be used to purchase a health agent to serve our counties. When we already have health agents that are through the collaborative, and those are the ones that are helping us out now when we don't have one.
Right.
So that's how we get both. And it is confusing, but the law very clearly stipulates that we cannot supplant any services that are already in existence and have been for some time for public health.
I see. Okay.
Gary, was I pretty right on about that?
Yeah. So for example, if we were already funding a public health nurse with Shutesbury dollars, the grant dollars couldn't go to cover any of that.
I see.
Time.
Yeah.
Okay. I get it now. I wasn't sure how that worked. So if there are towns in the collaborative that aren't spending anything on public health, does that mean they can just get all their services from the collaborative?
That's a good question.
Or is it a moot point?
There, I think there might. I don't know about Sunderland. Sunderland's been talking about sharing services with, like they do kind of Tri-County on their ambulance and so forth. So I don't know. That's a good question.
I think that
Yeah.
provided that they've signed on to the shared service agreement,
Yeah,
that the
probably.
community is signed on, that they would be eligible to receive those services by way of the grant.
So we spend something like $30,000 a year on the district, our share of what used to be a health agent and now is sort of a nothing. And the way I've been thinking about this is that in the future, if we can have a separate account, we could turn that, if the collaborative has a separate account, we could turn that money over. Suppose we stopped funding the district, what would happen? Would we not be eligible to get services from the collaborative?
I believe that is true.
Okay.
Yeah. So, and just, I think every town, perhaps with the exception of Sunderland, has money set aside. I know every other town does, and I'm not sure about Sunderland.
Okay, suppose the district went out of business. Suppose we voted this year to discontinue the district. so that we wouldn't have access to a health agent.
Then I think one of your new jobs and the board's new job would be to talk to the collaborative and experiment with how we set up this account so we could, if we decide to, turn our money over to the collaborative and they could hire a public health, a health agent for it.
Agent.
And it might involve something like what we've been doing is maybe they've hired somebody half-time and that would allow that person to be full-time and get full-time benefits. And it would be, a big advantage to the person they've hired and to us as well.
Right.
So it's that kind of thinking that benefits us to be part of the collaborative. And they seem to have more draw, I have to say, in terms of finding people who might be interested to work. It's a collaborative setting where there are people every day that you can bump into that teach you new things and, delve into some creative ideas and think about writing new grants. And, I think it's more interesting possibly.
Well, yeah, there's that. Plus, because of the scale, I think the collaborative is basically attracting all the good candidates, right?
Yeah.
Whereas the district is just too small to
Right.
really attract any actual talent.
Well, and let's face it, our collaborative really represents the majority of the population in Franklin County.
Mhm. Yeah, I've talked with Megan about this a little bit, and she indicated that we would basically have to go along the way we are for another fiscal year.
She did. Okay.
But that after that, she thinks that we will be able, because it would be the end of the grant as it exists.
Oh, that's right. Yeah, that's right.
Now, I don't
Right.
know if I think it's very dubious that we're going to get this $15 million from the governor's budget.
Yeah.
But if we were to get it, I wonder if the stipulations would be the same, or if we would be able to put money into the collaborative from our budget line.
I believe this legislation was written intentionally to create collaboratives. We're not the first collaboratives in the state. There are collaboratives in the eastern part of the state that existed before we did. So I think this legislation has been in place for more than 3 years.
Uh-huh.
And that doesn't mean it can't be changed or modified, of course.
Mm-hmm.
But yeah, I think you're right about that, Kat. It's because we do have funding for another whole fiscal year.
Right. Right. But it's making me nervous because I don't want to get stuck in a place where we don't have the district and we don't have access to the collaborative services, because then we'll be in a pickle.
Right. Yeah, I don't know how to answer that.
Mm-hmm.
But we've been without the services through the district for how long's it been? Since Claudia left, over a year, right?
Yeah, it's been about a year and a half.
So, and we've relied on the collaborative.
Yeah.
But who knows?
Yeah.
I don't know what's going on in this world, even though I'm going to be older next week.
That may be why. I think we're too old to understand the world anymore.
Possibly.
Yeah.
And that may be fortunate as well. It may be fortunate as well.
Maybe.
Maybe.
Could be.
Right.
Could be.
Right. We'll leave you poor young people to figure things out. Yeah, just for your information, the district hasn't met. We were supposed to meet a few weeks ago, and somebody failed to post the meeting in a timely manner, and so I was asked to say some other times that would work, and I haven't heard another word since. It's just ridiculous. But
we'll have to say those are the things that worry me about the district, and it's been like that for a while.
Yeah. if we could just slide right into the collaborative, I would drop the district in a hot minute. It's
Yeah.
just completely non-functional, not to say dysfunctional at this point. And there's no further word about the so-called health agent if he's going to be terminated, or he maybe even has been terminated, because they don't tell me anything, nothing. So, but I don't want to go into the meeting where we were supposed to be voting on next year's budget, and say, this is it. This is the last budget I'm going to vote for, because we're going to walk out of the district at the end of the year, because I'm afraid that somehow that might clear the pitch.
Yeah,
Yeah.
I understand.
Yeah. So it's a little bit nerve-wracking, but what can you do? Anything else you guys want to tell me? Or each other? Apparently not. So the next thing coming up is the pancake breakfast on March 14th. And that is the only reason I bring that up, is that's where we're going to get signatures on nomination papers for Garrett and Claire. And I'm planning to go. I have another meeting at 10, so I'm planning to get to the pancake breakfast at 8. If one or both of you are going to come, that's excellent. And if you're not, make sure I have your nomination papers, and I'll take them and get them signed.
Very good. Yep.
Okay, so it's the 14th, and the papers are due the following week, the 21st. And so just keep me informed, okay? Do we have any unanticipated business? Yeah, things are. Yeah.
I'm sorry, it's back to a subject. What is going on with the battery storage systems? Do we need to move on our regulation before town meeting, Kat, or what's our time frame?
No, originally I had thought we could do it before town meeting, but I don't think that we can do that.
Okay, and it doesn't really have any bearing on what the planning commission is going to be proposing either?
No, not really, because theirs is data centers.
Okay.
And right, and because we didn't meet and talk about it, I just responded.
Right,
responded to
yes.
that myself, and I didn't go to the meeting when they discussed it. I figured I'd said what I had to say.
Okay.
But if and when we do want to pass a regulation, we are not subject to a town meeting vote on that. Am I right?
That is correct.
We can implement or we can write a regulation, and as long as it is approved by the state attorney general's office as a valid, that it meets whatever criteria they have, then it is a regulation, right?
That's right. That's the difference between a regulation and a bylaw. Right. We have to have a public hearing.
That's right.
But we don't have to have a vote. Only we get to vote. So it seems pretty much impossible. I mean, here we are in March already. I can hardly believe it. And town meeting is May 9th. There's no way we're going to be done with this before that.
Town meeting is May 9th.
Yeah.
Okay.
I have one more thing to say. I'm going to be away for 3 weeks, starting March 30th, returning the 21st of April.
Okay. So you're going to probably miss both, or at least one meeting in April, and possibly the second one as well, the 21st. No, you should be back for that.
I'm flying back, so I'm flying back. Who knows? Who knows? We got a crazy world out there.
Well, yeah, there's that. So our first meeting in April, our meetings in April are going to be the 1st and the 15th.
Okay, so I'll miss both.
So you're going to miss them both.
Mm-hmm.
And
Claire, you're up.
I'm gonna miss both May meetings.
Okay, anybody else have travel plans that I should know about?
How far out do you want to know about it?
Well, I guess just this fiscal year, probably.
Okay, I'm gone, I guess that's technically the next fiscal year. We're gone for 3 weeks from June 19th through July 9th, but I guess that does not affect, it just affects the first meeting in July.
Right. I think that's so.
Technically the next fiscal year.
And I will miss March 18th.
Okay. And Arlene, you were saying the first meeting in July?
Correct. I think I just closed my online calendar, but
Which is the first.
the 1st of July will be
Okay.
out of town. Yeah.
Okay. All right. Well, we should manage to pull together a quorum.
Mm-hmm. Good.
All right. If we don't have anything else to say to each other, I wonder if maybe Claire has any questions about things or observations she wants to make or anything like that.
I don't think so. I'm
Okay.
planning on attending the pancake breakfast.
Great.
I got the nomination paper, so I have it. And yeah,
Thank
Okay.
you for
Yeah.
Oh,
being
yeah.
ready to do
Indeed.
this.
And we didn't scare you away last meeting, so
no.
There's still time.
No, Claire, it's a good crew. You're in very good hands.
I believe it.
Yeah.
Yeah, we managed to actually have fun too.
Yeah.
All right. Well, I suggest that we adjourn.
I agree.
Can I just declare that? Can I just use my executive powers and say the meeting's over? Go home?
I'll say the so moved.
And
All right.
second,
Okay, so that
Oh,
was
sorry.
for adjournment. All right, in favor, Garrett,
Yes. Oops.
Yeah.
Maureen, yes, Garrett, yes, Wim,
Yes.
Arlene,
Yes.
yes, Kat, yes. All right, we are done. Thanks, you guys.
Bye-bye.
Thank you.
everyone.
Some of you in 2 weeks, and Garrett, I hope you're going someplace good.
Haven't figured it out yet, but it's
Ah.
that week we're doing spontaneous.
Good.
Oh, nice. Well,
Right.
have a wonderful time.
Good.
All right, thanks. Bye-bye.
Bye.
Okay.
Bye, everyone.
Bye.
Good night.